Hey everybody, how are you? This is Jim Prusak, physical therapist from the Pain PT, and I want to continue our discussion today around the cause of pain and then the subsequent treatment because I feel like this is so important that you have a foundation of understanding the cause of your problem and then from that point forward having a approach or a treatment approach of what you should do. Now, we're going to talk today about if there's no physical cause, there should be no physical treatment. Okay, so if we can identify and rule out there's not a physical cause to your physical pain or your somatic symptom, then we don't want to be providing any physical treatment for it. Now, I'm a physical therapist and I've been practicing for over 20 years. So, my whole career, I've been applying physical treatments to people for different types of pain conditions. And one of the things I found is that for chronic pain, persistent somatic symptoms that are not having a physical cause, I actually do not want to provide a physical treatment. And so for me to say this as a physical therapist should mean something because when I give people exercises to do, for let's say for strengthening or for flexibility or endurance or balance, I'm giving exercises for that. I'm not giving people with chronic pain or chronic persistent symptoms exercises to treat or to fix something. This is very, very important because if you're trying to treat a mental and emotional problem with a physical treatment, it's not going to work very well. And I hear these stories every day, and I'm sure many of you have had the same thing where you've gone through many different physical treatments. I've seen people go through surgeries, real physical surgeries, and still have pain afterwards. And that's because the cause of the problem is not physical. Now, like I mentioned in my last video about coming up with the history and really trying to pin down what's the cause for the problem, we're looking for physical cause, so some type of damage, structural damage, pathology in the body. Or if that's not there, we have to move to mental emotional, which I see all the time in people. There's always something there, typically emotionally, that happened around the time of the onset of symptoms. Okay, not always, but in a large, large percentage of people, we can identify that pretty easily by just getting the history. Now, once we determine that, which basically means you have a diagnosis of what we call TMS, tension myositis syndrome, or mind body syndrome. Once you receive that diagnosis, and that's what I work with people on to first give that diagnosis, then our treatment needs to be looking at the emotional category, how we deal with and process emotions, and looking at things that happen around the time of the onset and exploring those things, exploring how we deal with our interactions with other people in terms of what we do with our emotions when we feel them. Basically, TMS and mind body syndrome is people feeling emotions physically, people feeling stress physically in the body as somatic symptoms. That's the easiest way to put it. And so we're trying to look at the stress, not the symptoms. So one aspect of the stress is emotional stress. A lot of good research showing that emotions can cause real physical pains or problems in the body. So we're looking to explore emotions and build people's emotional capacity, or what we call affect tolerance. I work with people on this to try to get them to be able to identify, acknowledge, feel, and express their emotions so that it does not be expressed in their body as physical pains or somatic symptoms. So emotional stress. And then we want to look at the mental stress. So, how your mind is working. Are you a person who puts a ton of pressure on yourself? Are you a people pleaser or a perfectionist or, or over conscientious or self critical or extremely hard on yourself? These are all driving into your body stress from your own brain. Okay, do you catastrophize, worry, ruminate, become hypervigilant? So this is the mental component of stress that we create ourselves from our own brains that then goes into our body to create that fight or flight sympathetic state, which then turns on somatic symptoms. So we have emotional stress, we have mental stress. We want to be focusing our attention on those two things when you receive a diagnosis of TMS, mind-body syndrome, neurocircuit pain, all the same thing, PPD, which is called psychophysiologic disorder. It's a more common modern medical term for this. Once you receive that diagnosis, you have to move away from the physical. It's sort of like you need to make a left turn instead of making a right turn, which is what everybody does. They move to the physical symptoms when in fact they should be making the other turn and moving towards emotions and your own brain and how you're processing and what you're putting in your body through your thinking and your thoughts. Okay, so I just wanted to come back to this today as a follow-up to my last video about getting a diagnosis and deciding whether your condition was caused by a physical stress or trauma, or is caused by an emotional stress or trauma, and then possibly a subsequent mental stress, or I guess mental trauma, you could even say, of your own thinking brain and how it operates. Okay, hope this was helpful, guys. I really want to point you to this because so many people I see are getting caught in the physical world. We want to move away from that if there's no physical cause. If there's no physical cause, there should be no physical treatment. All right, take care, everybody. Bye-bye.